Now, the universal health coverage was the hallmark of the health agenda for both Azimio, la Umoja and Kenya coalition and Kenya Kwanza Alliance presidential candidates, albeit with different implementation strategies. Ruto, Raila and Agano party's flag bearer David Mwaure Waihiga seemed to concur on a wide range of issues, from access to healthcare facilities and also drugs, adequate workers and drug supply, to an improved healthcare infrastructure as envisaged under the primary healthcare approach that Kenya has adopted in delivering universal health coverage. Kamche Mwenza unpacks these manifestos, sampling these contrasts in the contenders, the strategies in fixing that which ails the country's healthcare system. Let's take a look.
In their recently launched manifestos, Raila Odinga and Deputy President William Ruto were resolute on the realization of universal health coverage.
We'll initiate implementation of universal healthcare insurance.
A universal health insurance that will make sure that every Kenyan will go to hospital and they will walk away without paying a penny.
Each adopted a unique strategy in achieving UHC. Azimio has pegged its strategy on the Baba plan.
Now we are moving from coverage to care. It means we are moving from just ensuring that you are having that access near you, but ensuring that you have a certain predetermined capacity in terms of quality and in terms of affordability.
On access to good health, the Raila and Martha-led coalition says it will ensure that every Kenyan receives adequate primary healthcare services as needed, free at the point of delivery. DP Ruto and Rigathi Gachagua pegged good health on a fully public-financed primary healthcare that gives patients a choice between public, faith-based and private providers based on a regulated tariff.
We have seen both projects that they actually want to focus preventive and promotive, or what we can call collectively as primary health care. And basically what that means is that now we are coming to the realization that we actually need to guarantee Kenyans' health, not to guarantee Kenyans that will do all we can when they fall sick. Guarantee is protecting them, preventing disease so that they do not have to fall sick in the first place.
On supply of drugs, both parties will endeavor to engage and promote local production of drugs, equipment and other healthcare inputs.
We're going to promote research in our institutions here so that our people can be able to develop medicines that are made in Kenya rather than importing medicine from outside of our country.
We're going to bring private hospitals. We're going to bring public hospitals. We are going to bring other players, and we purchase drugs for Kenya collectively so that we eliminate all matters to do with transparency.
Both Raila and Ruto concurred on increasing community health workers, cognizant of the key role they play in realization of UHC.
We have seen them both provide that we are going to improve the budget. The Kenya Kwanza has provided the figures, which are quite encouraging. I think they detailed from 4% towards 15% as in the Abuja declaration. But what I would say overall is that looking at the two manifestos, I think we are going somewhere as a country.
Both Raila and Ruto intend to ensure all Kenyans are enrolled in the National Health Insurance Fund, NHIF. Ruto further seeks to change the contribution structure to a family or household basis and move away from the individual basis. This targets contributions of between 300 to 3,000 shillings per household per month. Under the Baba Care plan, Azimio has promised to establish an emergency medical service fund for emergency treatment. Kenya Kwanza promises a national fund for chronic and catastrophic illnesses and injury costs not covered by insurance.
No, it's actually the same thing. Let me say that on the other side, when you're talking about chronic diseases, you know that most of the private insurers will not insure you if you have a chronic disease. So that's a welcome move. Coming to the other side of the emergency fund, this has been a problem. It means people will be able to offer that emergency service, and then they are going to claim for what they have been able to offer. So that's another bold move.
On UHC, Agano Party's David Mwaure Waihiga is promising a National Health Commission to lower cost of healthcare, but his thrust in this agenda is on tackling corruption. They may not see eye to eye on a myriad of issues, but on health, they concur that a healthy population provides a productive workforce for a nation's development. A non-productive age group that is healthy reduces the burden of healthcare. Kamchemenza for Prime Edition, Nairobi.